Okay, welcome to episode 2 of the Original Take podcast. It's great to have you back with us. We have a really exciting episode today. So we're not going to mess around. We'll go straight into it. I want to introduce Dr. Lela Lewis. She's been doing some amazing work in this area if you're interested in vaccines, COVID, coronavirus. So, Dr. Lewis, may I just throw over to you? I think you're going to do a much better job of introducing yourself than I am. So if you could maybe introduce yourself to the audience so we know who you are and where you're coming from.
Well, it's so nice to be here with you, Seth. It's a great privilege. First of all, I just want to say a thank you for the opportunity of talking. And of course, my name is Dr. Lela Lewis. I'm a board certified obstetrician and gynecologist. I'm from Phoenix, Arizona. In addition to that, I have my master's in public health through UMass Amherst. And I've been spending the last 20 plus years doing lifestyle medicine. So in addition to being very passionate about women's healthcare, I'm extremely passionate about using lifestyle methods to prevent, treat, and in many cases defeat a lot of chronic diseases. And most importantly, I am the mother of 4 wonderful children.
Okay, thank you, Dr. Lewis. So in terms of the topic today, Dr. Lewis, we're really looking at how do we demystify this conversation, this global conversation that we're having around coronavirus. We're obviously around 2 years into it now. The story has really developed, it's changed, it's morphed, it's almost at breakneck speed, changing every day. So maybe if we can start off from your perspective as a doctor, as somebody who's really au fait with the science, perhaps if you could just give us an overview, a snap overview of where we're at with coronavirus now as we sit here at the start of 2022.
Well, you're right. It has been a little bit of a roller coaster ride for sure. I remember when the first cases were starting to come out in February of 2 years ago. Washington State, I believe, was the first state to have the first case. And as a physician, I'm just going to historically say what my experience was. I was watching, originally I thought, oh, that's just something that hit Wuhan, China. It's not going to affect us here in the United States. And even if there's a case or two, it's not going to be that big of a deal. And boy, was I surprised, just as many of my colleagues were as well. So when the first lockdowns hit, I was just starting a new job. We were hit very hard in labor and delivery. The first wave of cases, especially that summer, we really got a lot of cases. And then things petered down, as we know. Delta hit this last summer, the cases increased. And then, of course, most recently, we've had Omicron, which I have to say, in the hospital setting and both, looking at the statistics, it does appear that both the unvaxxed and the vaccinated are getting affected to a great degree. And I mean triple vaxxed. I have patients that are double vaxxed plus boosted, and they're still getting symptoms. And the same is happening, obviously, with the unvaccinated. But the good news is the severe cases that we were seeing with Delta, I'm not seeing as frequently. So that is a blessing. And I think that the statistics are definitely showing that the cases, although increased, the overall severity is less.
Yeah, and it's interesting you mentioned Delta and Omicron, and obviously how it's affecting both the vaxxed and the unvaxxed. In terms of how that narrative has developed, because I remember just like yourself and many kind of listeners, the start of the pandemic, it was the great unknown. What's going to happen? What is this? It's Wuhan. It's not going to hit me here. Then suddenly it comes. And the conversation from my perspective has really evolved in an interesting direction of we don't know what's happening, shut everything down, to vaccines will be the savior of the situation. How have you really seen that conversation evolve? Obviously, looking at the data, because it from my perspective, it's shifted sometimes subtly, sometimes very clearly. How have you seen that kind of conversation evolve in terms of the vaccines and the prevailing view that we're told in the media that really the vaccine is the only way that we can go to really combat this pandemic?
Well, that's a really interesting question, Seth. Originally, the notion was, as you said, okay, everybody, social distance, 6 feet apart, wear your mask, stay in your houses, don't go anywhere, and use hand sanitizer. And that's the best thing you can do for yourself. And wait for the vaccine. Wait for the vaccine to come out. There's nothing we can do. There's nothing you can do. Just wait till the vaccines come out. Well, we didn't know when those vaccines were even going to come out, and what was the kind of vaccine. We're talking back in March and April of 2020. Come October, September, October, November. Oh wow, the first rollouts at the end of or the middle of December. I was actually frontline because I was a frontline physician, so I was the first eligible for the vaccines, particularly for the Pfizer vaccine. And when it first was being rolled out, the answer was yes, definitely. Everybody's got to get it. This is our only chance to survive this pandemic. And that mentality clearly continued for the next few months, where the next phase, of course, was the elderly and those who are at higher risk. January, February of last year, people were just, being vaccinated. They were going off of exactly what they were being told by the media. There was very much a singular approach. It was one rhetoric, one voice. The only answer is take these vaccines, whether it be the Pfizer vaccines, the J&J vaccine, the Moderna. You've got to get the vaccine. If you get the vaccine, then only will you be safe from COVID. And you're not going to get sick from COVID. You're not going to spread COVID. This is the answer. Well, we began to see, based on the data, come summer, when Delta was hitting, maybe this information is not exactly accurate. And it was starting to come out that you can actually spread it, that the vaccinated could spread SARS-CoV-2. In fact, in some ways, because their symptoms were less, they were spreading it at a higher degree. They didn't even know that they were contagious, if you will, and spreading it to the unvaxxed or to the vulnerable. Then most recently with Omicron, we now know not only can you spread it, but you can get it and you can get quite sick. In fact, I have a attorney friend right now, triple vaxxed, wonderful person, sick with COVID right now. And so, but we are seeing that. And so as far as what the media has told us, and even what I dare say the public health department has told us, they've had to backstep. They've had to take steps back and say, well, actually, yes, we do realize that you can get it. Yes, it looks like you're not going to just be able to be basically cured, if you will, or protected if you just get your booster. Maybe you're going to have to get one maybe every 3 to 4 months. And that jury is still out. Or actually the new information, well, maybe we just need a new vaccine for Omicron variant, which, by the way, there's now a new variant off of the Omicron variant. And they're saying that one is spreading. And I think I saw something yesterday on Medscape, and I can't remember. I think it was around 60% of cases are now considered to be the Omicron variant of SARS-CoV-2. So I think what we're seeing is the answer that we have been told repeatedly for months and months, that the answer is the vaccine. The answer that the only way to prevent COVID, to prevent severe symptoms of COVID, to prevent the spread of COVID is to be vaccinated. We're finding that perhaps that rhetoric is not actually accurate, and we need to be looking in another direction.
I think that's a very interesting point you make there, Dr. Lela, in terms of, the rhetoric. I think that's a very interesting word that you use. I mean, speaking on behalf of people that may not be so well versed as yourself as a doctor, how can we kind of cut through that noise? Because we're not all, when you look at papers on the Lancet or different, I think you mentioned Medscape, it's really hard to cut through the noise of, how do I get to the truth of what's happening and make an informed decision for myself? So, I mean, do you have any kind of input or comments on how somebody who's just maybe watching this or listening to this and is saying, well, Dr. Lela, that's all well and good, but how can I make sense of all this deluge of information? Do you kind of have something that would be able to direct them and how they can kind of simplify what seems to be really complicated?
Absolutely. And I think the best answer to everyone for your health is, this is an issue of your health, right? This is your body. This is your most valuable resource. There's nothing more what do you have? If you don't have your health, you don't have life. what good is anything else? So your most valuable resource is your health. And so I cannot encourage people strongly enough to do your own research. And it's very simple, actually. We have the internet. A few decades ago, a decade and a half ago, we didn't have such wonderful, amazing information. Do a search, go to PubMed. If you want to have amazing information, go to PubMed and just start typing in whatever it is that you're specifically concerned about. Efficacy, SARS-CoV-2 COVID vaccine efficacy. You can pull up actual hard data yourself. If it's too difficult or too confusing, there's a lot of different resources. Our own website, I'm the president of Liberty and Health Alliance. We put out an article called the Reiteration document for the Liberty of Conscience document. And there's a lot of information in there with, again, scientific research on data on our website, libertyandhealth.org. That's liberty spelled out, A-N-D, health.org. There's a plethora of studies that someone could look through and evaluate for themselves and look at the information. But ask yourself, what's your most important resource? And would you only accept just general information, just whatever anybody sells for your most important resource? And then as a Christian, I happen to be a Christian. I'm a Seventh-day Adventist Christian. I personally believe that my faith makes a big difference to me. And so I go to God. I actually, when I wasn't sure what to do with the vaccine personally, and now I'm just personally tell my own slight bit of testimony. I have never been anti-vax. I have had every vaccine pretty much known to man, not every single one, but I've had yellow fever. I used to travel around the world. I've had lots and lots of vaccines. And so when December of last year rolled around, and like I said, I was the first line to get the vaccines, when it came up for me to be eligible, I just had an uneasiness. And I personally believe that, again, as a Christian, that my body is God's temple and I should value that. And whether you're a Christian or not, that same principle holds true. You should value your body because, again, it is your most important resource. And so, again, as a Christian, I felt like it was a religious issue. And so I took that to God and I asked him, and he did miraculously tell me twice that he did not want me personally to get the vaccine. And after that, I didn't even know, I myself didn't know where to get the information. My own colleagues oftentimes don't know that there is a plethora of information and research out there that has been, I dare say, squelched, kept from the masses. And I began to find that information and research it for myself. And so I would just encourage everyone to do the same. I would encourage you, ask God if you feel comfortable with that. But either way, go search for yourself and you will find the answer.
No, that's really clear, Dr. Lela. So maybe just taking a step back and that call to doing your own research, I think is really critical, because I think we live in a day and age where there is so much information, there is so much communication coming at us that we think is too much. I just need to go to a few trusted sources. I don't need to think too much and I'll just accept. Now, whether that be certain news channels, I'm not going to name any names, and you think, right, this is my trusted source of news. I'm just going to take very little thought, accept what I hear there. But as somebody kind of embarks, if they were to take your advice that you mentioned just now and really embark on that self-discovery, could you perhaps just help us in laying out the kind of the both sides? I know the media is very strong, pro-vaccine, but maybe you could just lay out the kind of both sides in terms of, okay, this is why you should get the vaccine, so people can help organize their thoughts. And then I'll ask you, once you've answered that question, really the case for what are the alternatives? Because in the media, it seems to be very biased towards vaccine as the only way. But I think there are other alternatives that people need to weigh up for themselves. So Dr. Lela, very kind of specific question. What is the kind of state of the argument for having a vaccine that we're seeing in the mass media at the moment?
At this point, we know, as I've already stated, we know it does not stop the spread. It does not prevent you from getting COVID. In fact, in some certain countries like Israel and other locations, which are, I forget what percentage, is it like 98% or so are actually vaccinated. They have some of the highest rates of COVID. So it does not prevent you from getting COVID. There is question at this point whether it continues to decrease the severity. I tend to think there might be an element of benefit in that regard, but everything is a risk benefit ratio. And I have to just emphasize that enough, that everything that we do has a risk benefit ratio, and particularly in medicine. So if you weigh the risk, and we could talk about some of those risks, but if you weigh the risks of getting the vaccine versus not getting the vaccine, and what is your likelihood of recovery versus potential side effects from the vaccine, there's where the question really lies. And so, does there seem to be a benefit in decreasing severity? I have to say, in the hospital setting where I work, I have seen that it does appear that probably a little bit more than half of the population, that maybe even a little bit more than that, that are unvaxxed do tend to have more worsened symptoms, if you will. But those individuals never got early treatment. And I just want to really emphasize that the ones that I've seen that haven't received early treatment, they can and do have more severe symptoms. Do the vaccinated still get symptoms? Yes, they do. Can they get very sick? Yes, they can. But it does seem to be a slight benefit there. And so that is where the media is going with this at this point. But they don't really even focus on that. If you want to know the truth, the real focus is still just get the vaccine. This is the way to end COVID. This is your responsibility. This is a responsibility that we need to put upon the children. Just get the vaccine.
No, thank you, Dr. Lela, for that. So you mentioned risk. You mentioned how do we approach making a decision for ourselves. I think that's a really critical point you've brought out. So perhaps if I could just pivot a little bit and look at the alternative viewpoint, because I think, as you mentioned, the media does really just get the vaccine with maybe a little light on the rationale. So really, what are the main kind of cases for the alternative? Why should people be, as they reflect, do I want to do this? Do I not want to do this? What are kind of some of the factors that they should consider? You mentioned risk, but in terms of alternatives, what do you have to say in terms of the alternatives to taking the vaccine? Are there options out there? Are they on that risk benefit ratio? Are they reasonable to take? Maybe you could speak on that for a little bit.
So I will say this, for the young population, those less than 30, some of us aren't less than 30 anymore, but for those less than 30, and particularly for the teenagers and younger, the risk is higher for the child, for the young person, I believe, than rejecting the vaccine. We're seeing a very large increase in myocarditis and pericarditis. The VAERS site is very clear. That's the site that keeps track as far as the vaccine side effects are concerned. The numbers are astronomical as far as the side effects are concerned, particularly with the heart in the younger populations. It's essentially, and what we're also seeing is a rise in autoimmune conditions, where the body is not knowing what to do with this foreign product, if you will. We're now making spike protein in our own bodies, and the body is, in some cases, mounting an immune response to itself, and we're getting, some of these effects of the pericarditis and the myocarditis, etc. So, and there's lots of other risk factors. I mean, the sudden deaths associated in the peri-vaccine first 30 days after the vaccine have gone up considerably. And I would just encourage people, go to the VAERS site yourself and take a look at that. But you can also access that through our libertyandhealth.org website. As far as alternatives are concerned, I think that this is an area that we've really left void. Again, when we started this whole pandemic, the idea was, okay, social distance, hand sanitizer, and mask, and that's all you can do. And, and just hope and pray that coronavirus doesn't come and get you somehow. And I fell into that. I was in that trance for several months. I I was scared to go to the grocery store. I had wore my gloves when I went to the grocery store. None of us really knew what we were dealing with. And as time went on, and this is someone who believes and trusts in lifestyle medicine. I've been teaching it for 20 years, and yet I too fell into this same group think, if you will. Like, well, this is what everybody's saying. This is what my colleagues are saying. It must be true. And then something clicked. Lela, again, as a Christian, I'm coming from this from a Christian perspective. God gave us principles in the Garden of Eden, which I believe took place, that actually optimize our immunity. This is all about our immune system functioning well. What can we do to optimize our immunity? And these principles are used for optimizing one's immunity so that it can be enhanced and fight off cancer cells. It's used for optimizing the immunity so it functions better, so it doesn't over respond and cause a autoimmune reaction, whether that be things like multiple sclerosis or asthma or you name it, Guillain-Barré syndrome even. But I guess what I'm trying to say is these same principles, I began to think, I'll bet you we just need to act on the principles and the science that we already know. And so some of the alternatives are, and I can talk about the pharmaceutical alternatives in just a few minutes, but I'll start with the nutraceuticals or the lifestyle principles. We have known for many years, and as a Seventh-day Adventist Christian, I happen to strongly believe this. We've actually been teaching this for 170 years, but now we know from science that the sun is a great sterilizer. The ultraviolet C rays is a wonderful method of providing a sterilization process. So get out and get your sunshine. Not only are you going to get into more of an open environment, of course, now we hear people talking about that, and subsequent to the initial lockdowns, we realized, oops, we don't really want people to just be in their houses and rebreathing the same air. We want them to get out and get fresh air and get sunshine. And of course, the sunshine is giving us vitamin D. Well, one of the best ways to optimize your immunity is up your vitamin D level. In fact, I tell patients that come down with COVID, and by the way, I had Delta. I had a pretty bad case of it, to go to 15 to 20,000 international units of vitamin D per day. You can take that for 5 to 10 days and then go back down to about 5,000. But again, that's just one simple principle that can be utilized. And again, the fresh air, every window in the home, get those windows open. I know we're in the middle of winter right now, and some places are colder than others, but even if it's just a crack every day, you've got to get fresh air and get that pollution, if you will, out. But you want those SARS-CoV-2 virons out. If you've got someone in the household that's sick, we know this from science. We've seen it. Again, open air dissipates. I mean, it's common sense though. It's if you're out in the open air, the particles, the viron obviously is much more minute than it would be if it's in an enclosed environment and you're just sitting there rebreathing the virus. So those are just a couple principles. There's many others, and we can talk about some of the other nutraceuticals that I use to actually treat COVID, if you like.
Oh, that would be great. And I think just circling back to a point you made, Dr. Lela, around the risk and the conversation evolving. In terms of the efficacy of vaccines, obviously that conversation has really grown and it's developed. In terms of judging and weighing against, okay, open the windows, there are things that seeming like, well, what's that going to do? Well, how's that going to help me with COVID? But I've got this vaccine that a lot of very smart people with a lot of letters after their name are telling me I should do. But that conversation really around the efficacy of the vaccine has really evolved from my perspective, what I've seen here in the UK. How would you balance that now that there's more data on the efficacy of the vaccine and weighing that against, okay, what are we seeing in terms of these alternative ways of addressing coronavirus and all the different strains that we have? You mentioned Omicron and Delta.
So it does seem to be that the virus, in fact, we've heard Dr. Fauci himself say this, that the antibodies, even after being fully vaccinated, even after being boosted, it appears as though the efficacy is dwindling by 3 to 4 months after the booster even. They're not for sure. Hopefully it lasts a little longer than that. Originally, we were told that 2 vaccines, we would be done. Everything would be great. Then we said, oh, well, it looks like it's going to be 8 months, and then you're going to have to get another booster. And now they're talking, well, it might be 3 to 4 months. So quite frankly, efficacy wise, as far as the ability for the vaccine to prevent the spread or the acquiring of symptoms, severe symptoms even, doesn't seem to be what we were originally told. As far as some of the other options are concerned, I'm just going to run through a few. I actually, if it's okay with you, Seth, I will give my protocol that I've now treated about 300 patients. I've not had a single one end up in the hospital. Some of them have been very, very sick. There were a couple that I was on my face pleading with God to keep well and keep out of the hospital. One of the ladies, she was morbidly obese. She had diabetes, high blood pressure, congestive heart failure, her and asthma as well. Her oxygen saturations were in the 80s. She was already into COVID 9 days before they reached out to me. And so we were a little bit behind the 8 ball. And I just want to encourage all of our viewers and listening audience, if you get symptoms, get early treatment. And I mean, even before your test is necessarily positive. I've seen this over and over again, where the viral load, just for one reason or another, is not high enough and the tests are coming back negative. And so people are just kind of festering this virus, if you will, until finally the viral load gets high enough, and then all of a sudden we get a positive PCR or we get a positive rapid. So what I do right from the get-go, and by the way, that sweet lady, she did just fine. She actually went to the ER. She'd been on my protocol only for, at that point, it was only 36 hours. Her family felt very nervous. They finally wanted her to go into the ER. She went in and everything was fine. Her chest x-ray was clear. Praise the Lord, she was better within about 36 hours thereafter. She had a little bit of a weakness period afterwards, but she did great. And she and a couple others were my most serious cases. But so far, by God's grace, we've kept everyone out of the hospital. So what is my protocol? We'll start with the nutraceuticals. I've already mentioned vitamin D, 15 to 20,000 international units of vitamin D. I use 4,000 milligrams of vitamin C. There's a lot of information. The antioxidant effect of vitamin C is absolutely pivotal. So those two, even amongst those who strongly push the vaccine, almost everyone does agree, because the science is so very, very clear that one of the leading predictors of mortality is a very low vitamin D level. So pretty much everybody agrees that high vitamin D and vitamin C is beneficial. From there, 50 milligrams of zinc once a day. I also recommend N-acetylcysteine, or NAC, 500 milligrams 2 times a day, but that's only for 5 days. I really don't recommend it on a long-term basis. NAC is a wonderful, again, an antioxidant. It works very well. But again, in the long term, there is some associated concern that I have, not necessarily documented for sure risk, but I just don't think it's necessary in the long term. I also recommend quercetin. If you look at Dr. Peter McCullough's protocol, he has many of what we're talking about right now on his protocol that has worked to treat thousands upon thousands of people. And quercetin is on there. Quercetin, 500 milligrams 2 times a day while you're symptomatic. And then after symptomatic, you can go back to, after symptoms resolve, you can go back to once a day on the quercetin. It also is a great way to help your immune system to get functioning at a higher level. Then olive leaf extract. Well, olive leaf extract is actually there's actually been quite a number of studies that have been showing that it does appear to have a great benefit with SARS-CoV-2. So go to PubMed, don't take my word for it, take a look, type in olive leaf extract. It's 500 milligrams once to twice a day. And again, you can take that for 5 to 10 days. It's not going to hurt you if you take it in the long haul, but it will help your white blood cell count and improve overall function. Something that I am just recently discovered, again, as a Christian, I look at my duty as a physician very seriously. Not only as a physician did I take the Hippocratic oath to do no harm to patients, but I also took an oath, I believe, before God, to protect the vulnerable and to be constantly seeking ways that I can help improve the health of my patients and the community around me. And so when all of this I don't know, this confusion, if you will, was going on. It was just a few months ago, I was falling on my face. I'm like, Lord, I said, just tell me if there's got to be something else besides exercise and fresh air and sunshine and eating a healthy plant-based diet full of these amazing antioxidants, berries and fruits and vegetables. In addition to that, there's got to be something else. And so I was looking on PubMed and doing my own research, like we've been talking about. And I came across two mushroom products that I found fascinating. The one was AHCC, which is shiitake mushroom. Fascinating information. What they found was that if individuals who had high risk HPV, high risk human papillomavirus, took AHCC, 6 grams of it once a day for 6 to 8 months, they actually eradicated or got rid of high risk HPV. Well, high risk HPV, as a gynecologist, it's the #1 cause of cervical cancer. And cervical cancer is the 4th leading cause of cancer for women around the world. So this is a huge deal. When I read that, I'm like, oh my goodness, I didn't know this. This is amazing, because normally we think human papillomavirus, you get it, you've got high risk HPV. That's bad news. You've got to be followed all the time, et cetera, et cetera. It's going to come back. And it's just very, very concerning. I thought, that's fascinating. What it's doing, what the studies showed, is it increased natural killer cells. Natural killer cells are part of your innate immunity, meaning it's just your body doesn't have to learn anything. It just already knows it. And it goes, and those natural killer cells goes, and they see something foreign and they're like, chop, 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 and they go after it. Well, it's increasing those. But it also appeared to be increasing the white blood cell count and increasing their effectivity. And I thought, wow, now that's interesting. I wonder if this is going to have the same effect on SARS-CoV-2. Well, around this time, I also discovered there's another mushroom called turkey tail mushroom, and also taken in 6 grams per day. In Japan, it's one of the leading actual treatments for stage 4 breast cancer. Why? Because stage 4 breast cancer, these individuals are perhaps undergoing chemotherapy. Their white blood cell counts have dropped. Their bone marrow is not producing the white blood cells to fight the cancer or to fight off and prevent other infections. So what do they give these patients? Turkey tail mushroom, 6 grams of it. Why? It increases the white blood cell count, and it increases their effectivity, so that if they encounter, let's just say SARS-CoV-2 or some other thing that shouldn't be there, the white blood cells are more effective. And at that moment, I was like, God, I just know there's got to be a benefit for SARS-CoV-2. Now, mind you, again, I know we may be talking to those who don't necessarily have the same faith system, but I'm telling my personal testimony. This is my story. I was praying to God for more treatment options, more ways I can help my patients. I find these 2 amazing mushrooms out. No sooner had I thought in my head, I'll bet you anything this will help SARS-CoV-2. Bing, my phone goes off. An article pops up I get a regular notification on some of these, different magazines and those kinds of things. And the first line says, UCLA and UC San Diego are studying shiitake mushroom and turkey tail mushroom as a treatment for SARS-CoV-2. In fact, it has entered into clinical phase 1 trials. I was like, okay, this is the way to go. I have now treated numerous patients, myself included. I started to get symptoms. My daughter, my 11-year-old, came down with Omicron about 3 weeks ago. And I started to feel like I'm getting a little sore throat, getting a little congested. I took my turkey tail and my AHCC, and I got better. So again, 6 grams per day, can't recommend it enough. Adding that to your regimen, it's going to be a wonderful, wonderful blessing.
Dr. Lela, I mean, we've got so much amazing information from you there. Thank you so much for sharing those protocols. If you're watching, we'll include a link in the description where you can go over all of the protocols that Dr. Lela's outlined. So don't worry if you didn't catch it. You can always rewind and go over it again. But Dr. Lela, if I may, thank you so much for what you shared so far, and giving us a context to move into as we're trying to build our own perspective and our own informed choices around COVID. If I can just look forward a little bit, what do you see as the main themes moving forward? What should we be looking out for? You know, the buzzwords we're seeing thrown around: learning to live with COVID, the new normal. What would you say are kind of maybe one or two things we should keep front and center in our minds as we evaluate critically what's going on around us in terms of coronavirus?
And I just want to add one other quick thing, Seth. I would be remiss if I didn't mention that the early treatment pharmaceuticals, if that's okay, just very quickly. Again, if you don't have that information, you can always go to American Frontline Doctors. You can go to myfreedoctor.com. But this is what I recommend. It's ivermectin, 0.4 milligrams per kilogram once a day for actually, I treat patients for up to 10 days. And then hydroxychloroquine, 200 milligrams, 2 times a day. I do recommend everyone taking an aspirin just to keep your anticoagulation down as much as possible. So a full strength aspirin, that's 325 milligrams once a day. Let me add one other quick thing. Turmeric, I almost forgot. 900 milligrams 3 times a day. It's a wonderful anti-inflammatory. It also benefits the immune system. And then I also recommend, from the pharmaceutical perspective, azithromycin or a Z-Pak with, for 5 days, and then with a possibility of a refill. So I just wanted to add that, if I could, just briefly. I just wanted to make sure that our viewing audience did get that information. And that regimen, those two, all of the things that we talked about, plus hydrothermal therapy, which we probably don't have time to talk about here, but you can go to our website, you can watch our videos. We talk about how to do that. That has kept 100% of my patients, hydrothermal therapy plus an onion poultice plus everything we just talked about, 100% of my patients have stayed out of the hospital. So I just wanted to add that. But coming back to your question of, where do we think we're going to go from here? I don't know. I don't know that anyone knows where we're going to go. If we sit and focus on, if one sat and listened to the media, it is so much fear mongering. It has led, I believe, to those of us in the Western world to give up liberties and freedoms that we have held near and dear to our heart forever. I just recently saw an article that COVID doesn't cause us to end up in a totalitarian society. That is us giving up our rights. That can only happen out of fear. Okay, we want you, whoever it is, whether it's the government or any other entity, to take control of our decision making. And for me, liberty of conscience, the ability to pursue life, liberty, and the pursuit of happiness is what we here in the United States, and quite frankly, as citizens of the globe, have a right to. We are made, I believe, in the image of God. And thereby, we have the right to choose for ourselves what happens to our most important commodity, for ourselves. And if an individual chooses, they weigh the risks, they weigh the benefits, and they believe, the vaccine is the best answer for me. You know what? Praise God. That is your decision, and you have the right to that decision, and no one should stop you. But if someone else has the conviction that they have concerns there, whether it's concerns about the risks or the efficacy or whatever the reason is, if they believe that it's not in their best interest, or that perhaps God doesn't want them to do it, that's their right. And they should have the same right to refuse it, just as the other person has the right to accept it. And so what I see happening in our society and around the world, here in the United States and around the world, is out of fear, the individual, wherever they are, have given up their mental thought process, their decision making, and even their individual rights to the governing bodies to make those decisions for them. And that is a concerning thing to me. So I can't emphasize enough that I believe, And our organization is called Liberty and Health Alliance. Why liberty and health? Because we have liberty. God gave us liberty, and each of us as individuals were given liberty to choose for ourselves what should or should not be done to our bodies. And as far as our health is concerned, we have the right and the ability, and we should know how to best prevent disease and treat it using optimal methods of immunity. And those should be our individual choice. So I guess that's my biggest concern now as I look at societies that are, causing people to lose their jobs, causing people to, there's certain countries now that are even forbidding basic health care aside from COVID if you're unvaccinated. And that's a very, very concerning thing to me.
Yeah. It's an interesting aspect, Dr. Lela, that you bring out that I think is, if we, as we kind of come to the kind of close of our discussion, you mentioned that liberty. I think here in Europe, there's some very interesting cases in terms of France, politicians coming out saying we just want to make for people that have made a different choice not to be vaccinated. If you look at countries like Austria, where really it's mandated. I think in France, memory doesn't serve, but it's become if you're over 65, you have to get the vaccine. It's against the law. And I think that those aspects you bring out around conscience, around liberty, and the real social fabric and the social contract being changed as a response, apparently reasonable response. Others might say it's a disproportionate response to COVID, changing social contract. So from that perspective, Dr. Lela, what would your message be to those that have an alternative view? What would your call be to them? Because it's tough. You're facing losing your job, losing your ability to put food on your table. What would you say to those people?
Well, I could say, I had a job that I loved with all my heart. And because of the position and that I took, that I too lost my job. And I would just encourage you to follow your conscience and to voice your concerns. Don't go along with the masses. If we all go along, if we all succumb, who's left? What have we gained? And what's going to happen to our children? We in the Western world have fought for liberty. We have fought for the ability to have freedom of speech, freedom of the press, all of the things that are now threatened. I just would encourage you, stand for what you believe, stand for your principles. If you believe this is a religious issue in your mind, stand for it. God will strengthen you, but don't just succumb to what everyone else says. And I would also strengthen you and encourage you that God will be with you. He has promised, I will never leave you nor forsake you.
Dr. Lela, thank you so much. This has just been such an amazing time and such valuable insight and encouragement, I think, as well, that you shared this. Very quickly, where can people reach you? I know you've mentioned Liberty Health Alliance. Where can people reach you if they're interested in what you've had to say today and want to find out more?
Yes, I would just encourage you to go to our website, Liberty and Health, that's spelled out, andhealth.org, and you can email us and they will directly connect you with me if you have specific questions. But again, stay happy and stay healthy and trust that God will keep you well.
Dr. Lela Lewis, thank you so much for spending some time with us on The Original Take. We wish you all the best, and hopefully we'll see you again soon and you can share more knowledge with us again. Thank you very much. Thanks for watching. Don't forget to hit like and subscribe, clicking the bell icon so you're notified whenever we upload.